Hey, I'm going to tell you a little bit about ginger and why you'd want to use it for quite a few different things. It's actually a pretty safe um, herb to consume or spice, but we are going to talk about that a little bit later. So, if you have some ginger, um, you want to actually, if you have it in your yard or you're growing it, you want to collect the ripe root from 1 to 2 year old plants when the foliage has died down, and you must store the root in a dry place. Once it begins to start sprouting, it will lose its medicinal properties, so you want to use it before then. Okay, so ginger has, of course, most of us anyway, know that it can help with nausea and vomiting. Me, in the past, it actually caused me to feel nauseous before when I've used the spice, and I've since learned that if you use too much ginger, it can have the opposite effect on you and make you feel nauseous. But really, it's used a lot of times to help with nausea and vomiting. And that's because it has a constituent in it, or you could say an ingredient, called 6-gingerol, and that's what does it. Interestingly, also, ginger has a digestive enzyme called protease. A lot of times you'll get the digestive enzymes, the bottles, and on the back it'll say protease listed as one of the enzymes. And it's very similar to papain, which is from papaya, or bromelain, which is from pineapple. But this protease is what is helpful for flatulence and makes ginger also a great digestive tonic. In addition to protease and the 6-gingerol, other constituents contained in ginger would be vitamins A and B3, tryptophan, which can make you feel happier, lecithin, lipids, fatty acids, iron, potassium, starch, and a few other things. Some really big words that not many of us really need to worry about at the moment. In fact, the combination of vitamin B3, tryptophan, and lecithin that is contained in ginger, it produces a mild tranquilizing effect. And so ginger is often used in nervine formulas for this reason, and is particularly helpful for painful menstruation. So ginger has so many good uses. I'm going to go through a list here. So just listen carefully because I'm going to go through it pretty fast. So it helps with amenorrhea. So if you're actually missing periods, lack of appetite, bacterial dysentery, catarrh, cholera. It helps with lowering cholesterol. It helps with having cold extremities, cold hands and feet. It helps with actual colds, colic, constipation, diarrhea. It is a digestive tonic, so it actually kind of helps all of your digestion. It helps with dysmenorrhea, which is painful menstruation, a dyspepsia. It helps with exhaustion during or following childbirth. Now, take note that's during childbirth. I'm not saying during pregnancy. It helps with flatulence, headaches, sluggish heart, inflammation, parasitic infections, particularly the trichomonads found in the vagina, the bladder, and the prostate. It helps with snake and insect poisonous bites, rheumatism, sore throat, toothaches, travel sickness, and worms. If you're familiar at all with turkey rhubarb and gentian, those two herbs, they work really well with ginger if you're trying to make yourself a blend. Ginger is also used sometimes for inflammatory conditions like rheumatoid arthritis. There was a small-scale pilot study done where participants with chronic knee osteoarthritis were given 25 milligrams of ginger and 5 milligrams of echinacea for 30 days, after which they reported less inflammation and decreased pain. Ginger has also been used for hypertension. And it's pretty neat that some researchers had conducted a trial where they put green tea, cinnamon, and ginger together and found that not only does ginger have anti-diabetic effects, but its effects are enhanced when it's used in combination with green tea and cinnamon. Because they tested each individually too, but they actually work better together. And you find that with a lot of herbs sometimes. Pairing two or several herbs together creates a stronger punch in trying to battle whatever you're trying to fight. So as far as pregnancy, like I mentioned and emphasized earlier, it was thought at one time that ginger would be really good to use for morning sickness. But that's it's controversial. So the decision to use ginger during pregnancy should be based on possible benefit compared to the potential risks, because I'm just going to quote this here. Although many authorities advise against using ginger during pregnancy, taking ginger orally seems to reduce the severity of nausea and vomiting in some pregnant women with morning sickness. Ginger seems to be more effective than placebo and comparable to vitamin B6. It has shown to be effective at preventing nausea induced by chemotherapy when it's given after compazine. And it could be effective as taking Reglan, or metoclopramide is the generic term, for reducing post-surgical nausea, vomiting in patients not currently receiving anesthesia or narcotic analgesia. So again, if you're not receiving the anesthesia or the narcotics for pain, the ginger is really effective. Okay, and here it states, and I should note that I am actually reading from a book in my studies, going through my schooling. This is my Herb 303, Herbal Materia Medica 2 book, published by American College of Healthcare Sciences, written by Doreen Peterson. So this information is really coming from there and not from my own thoughts. Okay, so additionally, a lot of people are suffering from vertigo, and they don't know how to treat it or help in situations where they're suffering from vertigo. So ginger, taking 1 gram of ginger orally, appears to reduce symptoms of vertigo, including nausea. However, it does not seem to reduce nystagmus, and those of us who have nystagmus would know what that means. So ginger, we've been talking about really medicinal uses, using it therapeutically, but you can use it also as a spice in your culinary efforts. Ginger can be used generously. It can be used raw in salads and salad dressings, stir-fry dishes. It can be added toward the end of cooking soups and stews, particularly beans or lentils, to reduce the flatulence that these foods can cause. Little tip there. All right. So let's talk for a moment about the safety of ginger. Again, I mentioned it's pretty safe, but there is the possibility that you can take too much. And also taking it along with certain prescription drugs can be dangerous. Ginger has an antiplatelet action, so it could interact with antiplatelet or anticoagulant drugs. These would be even aspirin, Plavix, Fragmin, Lovenox, heparin, Ticlid, warfarin, and others. Also, it potentially can interact with calcium channel blockers. These would be prescription drugs like Adalat or Procardia, Kalin, Asoptin, Verilin, Cardizem, Dynacert, Plendil, and Norvasc. Not a shame. Ginger's ability to increase the release of insulin could result in a potential interaction with anti-diabetic drugs and even cause hypoglycemia. These would be drugs like Amaryl, Diabeta, Glyinase, Prestab, Micronase, Glucophage, Actose, and Avandia. Now, as far as how to use ginger, so again, I mentioned, in the kitchen, you can sprinkle it on salads, things like that. And if you're going to use the powdered spice, you want to use only a quarter to about a half teaspoon. If you're going to have it in tablets or capsules, the powder, you're going to use 1 to 4 grams per day, and you're going to divide those doses. You're not going to take 4 grams all at one time. You can make a ginger infusion, and you're going to do 8 to 10 tablespoons, 3 to 4 times a day. If you're doing a juice made from ginger, that's half to 1 teaspoon 3 times a day. And a fluid extract is 1/4 to 1/2 milliliter 3 to 4 times a day. But yeah, and you can use a tincture also. That would be 1.5 to 3 milliliters 3 to 4 times a day. All right. So when it comes to administering ginger, also, you don't want to boil it because the volatile oil in it, which carries a lot of the great constituents or ingredients, evaporates and is destroyed. But I would suggest using ginger for quite a few things. If you're taking, especially like emmenagogue herbs, which help tone and strengthen your reproductive system, ginger can actually provide some transporting action to get those other herbs into the right places of your body where they need to be so that they can work in the most efficient manner. So I'm going to list a few ways that you'd want to use ginger to help with certain conditions, because something I've learned too with herbs that it matters how you prepare it. If you use it raw, it can help with certain things in your body. If you use it as an infusion, it can help with other parts of your body, and so forth. So when you are having issues with your periods, say you're missing them or they're very painful, you want to use a hot ginger infusion. So you might want to rewind this and hear again how much of an infusion is safe to take. If you have an issue with bacterial dysentery, you're going to use the fluid extract. If you want help with the catarrh, constipation, or rheumatism, you're going to use the fresh juice of ginger. With high cholesterol, dyspepsia, flatulence, a sluggish heart, inflammation, sluggish digestion, and worms, you can use the infusion, the extract, the tincture, and you're going to use it daily. The powdered root can also be mixed with water and given orally. And then if you want to use ginger to help with colds, you're going to use the warm infusion before bed, or you're going to mix the powdered ginger with cayenne into a hot lemon drink. Think about that cayenne. For diarrhea, you're going to combine the ginger with astringent herbs. So you want to research some astringent herbs. For exhaustion during and after childbirth, you can use sips of the warm ginger infusion or extract, or the powder mixed with water. For headache, you would take 500 milligrams of ginger at the onset and repeat every 4 hours up to 1.5 to 2 grams per day for 3 to 4 days. For morning sickness, if you choose to use it, that would be around 250 milligrams 4 times daily, up to that amount. And that's what's been used in research. However, due to concerns about its cholagogue effects, taking a tea up to 3 times a day may be a more cautious measure. For nausea and disequilibrium resulting from selective serotonin reuptake inhibitor, or the SSRI discontinuation or tapering. So when you're trying to get off of those SSRI drugs, you want to take 550 to 1100 milligrams of ginger 3 times daily. That's at least what's been used in research. And for preventing post-operative nausea and vomiting, 1 gram of powdered ginger root 1 hour before the induction of anesthesia has been used in research. For chemotherapy-induced nausea, you're going to do 2 to 4 grams of powdered ginger daily. And a ginger tea has also been used and typically prepared and taken on the day of chemotherapy and continued for as long as it's needed. For osteoarthritis, you're going to make a specific ginger extract. That's 170 milligrams 3 times daily, or 255 milligrams twice daily. That's what's been used in research. For a parasitic infection, you're going to use the extract or the tincture. Poisonous bites, you're going to use a poultice with fresh ginger root. For sore throat, you can do a diluted extract or tincture that you can gargle. For toothaches, you hold the infusion in your mouth or rub some freshly cut root onto the tooth. And for travel or motion sickness, you would chew the preserved ginger, take 1 gram of dried powdered ginger root 30 minutes to 4 hours before travel. And also, I mentioned warfarin earlier. This also has blood thinning effects, so please be careful. Okay, well, that is a lot of information on ginger, a lot of uses for ginger, a lot of good reasons to get ginger into your diet, even daily. It is quite safe. Again, if you're taking some prescription drugs, you need to really check into that. All right, until next time.